Distinguished colleagues, esteemed partners, ladies and gentlemen, it is a great honor for me to speak today on behalf of the World Health Organization as we mark 15 years since the Great East Japan earthquake, the devastating tsunami, and the subsequent accident at the Fukushima Daiichi nuclear power plant. This is a solemn anniversary, one that carries profound meaning not only for Japan, but for the global public health community and for all of us who work to prevent and respond to radiological and nuclear emergencies. Today, we remember the lives lost, the communities disrupted, and the extraordinary resilience shown by the people of Fukushima. We also acknowledge the immense scientific, medical, and public health efforts that followed, efforts that continue to shape global understanding and preparedness for nuclear emergencies. Allow me to pay special tribute to our colleagues at Fukushima Medical University, FMU. Their work over the past 15 years has been nothing short of exceptional. As a member of the WHO REMPAN Radiation Emergency Medical Preparedness and Assistance Network, FMU has demonstrated unwavering commitment to scientific rigor, transparency, and service to the affected communities. FMU researchers and clinicians have shared their findings openly with the world, often under intense pressure and always with a deep sense of responsibility. Their contributions have strengthened global evidence for radiation health effects, mental health impacts, risk communication, and long-term community support in the period of recovery after nuclear accident. This openness sets a global example for scientific transparency in the aftermath of a nuclear emergency. The lessons from Fukushima are not simply technical. They are human lessons about trust, communication, community engagement, and the importance of listening to people's concerns. They remind us that preparedness is not only about equipment, protocols, and supplies. It is about engaging with the community, about credibility of science and the ability to communicate clearly and compassionately in moments of uncertainty. These lessons are more relevant than ever as we meet today in a world facing renewed geopolitical tensions. We are witnessing increasing pressures on the international arrangements and agreements that have helped for decades to prevent the use of nuclear weapons. Once unthinkable possibility of their use has re-entered global discourse. This reality underscores the urgency of strengthening public health and medical preparedness for nuclear emergencies at all levels, local, national, regional, and global. Fukushima taught us that even in the most advanced and well-prepared societies, emergencies can overwhelm systems and challenge the assumptions. It taught us that misinformation can spread faster than radiation, and that communities must be engaged not as passive recipients of information, but as equal partners involved in decision-making process. It taught us that long-term health monitoring, mental health support, and transparent communication are essential pillars for a recovery. And it taught us that international cooperation is indispensable. WHO remains committed to working with Japan, with Fukushima Medical University, and with all REMPAN partners to ensure that hard-won lessons of 2011 continue to inform global preparedness. We must translate these lessons into stronger health systems, better trained medical and public health professionals, more robust risk communication strategies, and deeper collaboration across borders and across levels of response. As we honor the past, we must also look forward with humility, with vigilance, and with determination. The people of Fukushima have shown the world what resilience looks like. Their experience must continue to guide us as we confront the uncertainties of today's global landscape. On behalf of the WHO, I extend our profound respect and gratitude to the government of Japan and Fukushima Prefecture, and especially to the dedicated staff of Fukushima Medical University. Your work has protected health, advanced science, and strengthened global safety. The world is safer because of your contributions. Arigato gozaimasu.